Hello, everyone. My name is Leslie Welch. I am co founder of Birth Detroit and of Birth Center Equity. And it is my honor to welcome you today to Reclamation, the rise of midwifery and birth centers in communities of color, and the screening of Bearing the Burden, Black Mothers in America. And what I would like to do as we enter into this space is I want to welcome you to a conversation about healing, reclamation, and about our power. In Birth Center Equity, we believe that birth has the power to heal individuals, families, and communities. And I want to invite you into that belief and give you an invitation to both historical and social consciousness and to reimagining and possibility, right? To reimagining and possibility. And so, with that, I would like to thank Sarah Weiser for her vision for this film. I would like to thank Isadora Varejon for her help organizing this event. I want to say thank you to the Solutions Journalism Network for their focus on, and I'm going to take a word from Grace Lee Boggs, their focus on solutionary journalism, right? And highlighting the solutions to our greatest problems where they exist in our communities. And with that, we had you take a poll to tell us a little bit about yourselves. And I'm going to have Isadora show us who we are and what we learned about who's here. So if we could see the results of our poll. All right. So we have advocates, one academic, midwives, of course, are representing one third of us, doulas, another third of us, pregnant persons and parents, nurses. No docs on with us today, and they need to be here, huh? Students, public health professionals, and media professionals. Welcome, all of you. And then, is there a community birth center in your area? 50% of folks are saying yes, which is amazing. And then 35 no, 35% no, and 16% are not sure. Hopefully, after today, you will know if you have one and where it is and how you can support it. And then, if you became pregnant, how likely would you be to use the services of a birth center? And most folks are saying either extremely likely, very likely, or somewhat likely, and a handful not so sure or not likely. And so, with that, let's close off our poll. I want to welcome our esteemed panelist, Nakia Grayson from Choices in Memphis, and also a star of the film. Taj James from Full Spectrum Capital Partners, and my sister in Birth Center Equity, Nashira Burrell, co-director with me, and also director of Neighborhood Birth Center in Boston. And then give the floor to Sarah. Sarah, if you could please share with us about your vision and background on the film.
Yes, thank you so much for everybody for coming today, and to Leslie for leading us through this event, and Nashira for all your help getting this off the ground, and then of course Nakia and Taj. It's so wonderful seeing you both again, and thank you for all your help throughout this whole process as well. I produced this documentary with a whole team of people at Retro Report, and for a little bit of background about us, I'm not sure if everybody's familiar with who we are, but we're an independent nonprofit news organization, and we partner with other news outlets to produce documentaries on a whole variety of topics, but really always with the aim to bring history and context to issues in the news today. And with this story, I think sometimes when we talk about issues surrounding maternal and infant health and racial disparities and outcomes, we tend to focus only on the problems and not so much on the solutions. And I think as I began researching this and talking to more and more people, I was just really struck by the way communities of color were really reshaping their experiences around pregnancy and birth, and doing it in a way that was pushing back against a system that wasn't treating them well, and also really in a way that was improving outcomes and improving the health of moms and babies, and also really in a way that was creating a much better experience for everybody involved. Um, the more people I talked to doing this work, and people who've been involved in this work for decades, it just, sorry if my messages are going off here, but there's just so much history to this, and I think I hope I was able to sort of get at a slice of that history in this, but I just think what struck me was how fraught really our country's relationship with midwifery has been. And I'm really grateful to everybody who shared their stories with us for the piece, and shared with us their knowledge and their expertise, and really their help in bringing this history and their stories to life. And so with that, I will turn it back over to Leslie, who is doing all this important work every day on the ground, and she can take it from there.
Thank you, Sarah. A couple technological notes before we begin is that for your questions, we invite you to use the Q&A box for your questions. The button is located at the bottom of your screen, right? The Q&A box. And to use that instead of the chat so that we can track those questions, okay? And what I would like to say about the film before we begin is to acknowledge, right, that the film anchors us in the painful truth of the maternal mortality crisis, the racialized criminalization of midwifery, and it begins with the neglect, trauma, and death of Amber Isaac. And we have intentionally chosen to start the film a few minutes in. And this is in recognition of all the ways that we listen with our whole bodies, we feel what we see and hear. And those of us who do this work every day very much understand Amber's story and know and have loved women like Amber, right? And so we don't want to recount the trauma here. But before we do begin, I want to ask that we all hold Amber in our hearts, that we all hold Bruce in our hearts, that we all hold baby Elias in our hearts, and that we hold our sisters and babies, others that we're also grieving. And in their name, we're going to explore what's possible for a better future. And so we invite you to watch the whole film after the event, and it'll be available to you on Retro Report's YouTube channel, and the link will be sent via email. And right now, we're going to drop a link in the chat box that will take you to a site to view the film with us. Um, for those of you who are using Firefox as a browser, you might see an error message, but it's okay. You just need to click on the button that says Open Site in New Window. So you'll find that link there in your chat box. Please go ahead and click on it to view the film. And when you return back to us here in Zoom, I would love for you to go ahead and let us know in the chat box that you're back, maybe by sharing some of your thoughts even. So let us view the film. I'll see you in a few minutes. So, in this moment where we have most folks returning and back with us, I want to invite you to tune into your bodies and reflect on what you're feeling and holding as you experience the film with us today. And so this invitation is not just to have a head response, but as as was mentioned in the film, to bring your whole self to the conversation, right? Head, heart, and body. And so we're going to do what's called a chatter fall. And in the chatter fall, how this works is I'm going to ask you a question, and then you're going to type your answer in, and then I'm going to count down before we press enter on our answers. Okay? And so the question is, and we can, someone can drop the question in the chat, is how do you feel in your body and in your heart in this moment after viewing the film, right? How do you feel in your body and in your heart in this moment after viewing the film? And so go ahead and type your answer, but hold it. Don't hit enter yet. Give you a few seconds to type your answers. How do you feel in your body and in your heart in this moment after viewing the film? I can see some folks typing still. And I'm going to go ahead and count down from 3, 2, 1. Now hit enter. Take a moment to read what you see. Acknowledging tears and tiredness, heavy hearts, open hearts, hopeful hearts. Feeling of betrayal and neglect. I've seen annoyed and angry but hopeful, proud of the ongoing fight, summoned and called. Yes, yes, yes. Let's move to our panel. And speaking of summoned and called, we're going to start with Dr. Nakia Grayson. And it's so beautiful to see Choices, an exemplary full spectrum birth center that so many of us aspire to be like, that is successfully centering brown and black families and people on Medicaid. And so, Nakia, I want to invite you to just talk to us about what it takes to build a birth center like yours.
Yeah, let me say that even in watching the documentary, and and I said in that that I chose to start this space in Memphis, but this was an idea that was thought of before I decided to join the practice. I'm just thankful and grateful that it is me who was the one who was initially came to Choices and really helped to lay the groundwork for this. It's really been a team effort. It takes a lot of work to do something like this. We have an amazing administrative team. We had an amazing visionary executive director in Rebecca Terrell, who really saw the need for a comprehensive center in Memphis. And fortunately, I saw the need for, growing Black and brown midwives, right? And so that was really important to me. And I think that one of the amazing things about Choices is that, it was here before. It was always a small clinic that was here, and it is a community asset and had many resources available. And so, to be able to come in and to add the midwifery services, while it was a really heavy lift, it was well supported by the board of directors as well as the staff here. And that kind of made it a little bit easier, right? But it is something that we conceptualized and built from the ground up. And we recognized the need in the community and really just answered the call and stepped into that gap that we saw in the community and recognized that we were going to really need a lot of support in terms of community support. But the community was asking for this. You know, they wanted this. They wanted midwifery services. They wanted to have a say in their care. And we were just at the right time in the right place. One of the things I will say is that Choices was a very small, first trimester abortion clinic that has been here since 1974, which was right after Roe v. Wade, and really operated that way for a long time. But the people that we realized that we were seeing in terms of who were coming to us for abortion care were just at a different point in their reproductive lifespan, right? So, and they wanted to stay with us. They wanted the same non-judgmental, high quality care that they were receiving from us. And so we decided that we wanted to care for them too. We wanted to continue that care and continue to provide them with the best outcomes that they can have. And so adding the midwifery services really was necessary. And it was a huge pivot for us also because the clinic is now midwifery led. I am the director of our clinical services, and we have 4 midwives on staff now, and we provide all of our care. So we're providing this full spectrum care here in Memphis, and it's amazing. And we're hoping to really be able to grow more midwives and grow more clinics like this, and and really work on the sustainability of this and move it forward.
Yes. Thank you, Nakia. And we should all hope, not hope, it should be a reality that we all have non-judgmental, safe, quality care through that whole spectrum. And thank you for being an example of that, providing that. Um, my next question, I'll pass to Taj, and that is, in the film, Dr. Jean DeClercq talks about systems, and he says systems don't change very easily and without much pain. And so, my question is, what are your thoughts on systems change and movement work and the resources needed to grow more birth centers like Nikia's?
What is happening in this work is sacred, and the wisdom of coming together in community to bring forward the next generation is literally something we've been doing since we've been human. And so there is something profound in this moment about just returning to what is most important, most central, and most basic, and figuring out how we get everything else out of the way of what matters most. That's really our challenge. It's just kind of remembering how to be human again. Because these systems that we find ourselves in, though they're full of people, the systems themselves are quite dehumanizing. They're dehumanizing to the people who they're intended to serve, and they're dehumanizing to the workforce within the systems themselves. And so it's an opportunity to say, what would it take and what would it look like if we came together as communities and as people and as human beings to do this in a way that truly serves the little ones who are coming through and the big ones who are bringing them through, right? And just to have the, going back to Grace Lee Boggs, the radical imagination to believe that it's possible to do it in a good way, in the right way. And so there's a lot of attention in this country to other systems that are supposed to provide care, but they provide harm, right? Systems of safety, policing, right? And there's a recognition that those systems don't deliver the safety and the care that they were intended to provide. And there's the question of whether we can train our way out of the problem, or we can reform those systems, or whether we have to actually take a fundamentally different approach. And what's powerful to me about the work that the three of you are doing is that you are living through and navigating those contradictions as public health professionals, as people, as medical providers, as folks committed to different outcomes and good outcomes for our folks. How do we straddle and navigate what needs to happen in a community context and what needs to happen in an institutional context? And how does the work that we do in communities transform the institutions that right now we're dependent on for care? And so those are not easy issues. Those are not complex issues, but they require our communities to really like tap into our whole selves, tap into our full power, which means we've got to connect to the cultural and historical wisdom, and we've got to bring financial resources to the table in the right way, knowing that if we trust the wisdom of those whose wisdom has been invalidated and denied, right? And that is a harm that needs to be repaired. It's not just an apology. There's reparations to be paid, because those who know their wisdom was invalidated. And we have to start by acknowledging that harm and repairing that harm. But then we have to put resources into the hands of the people whose experience and wisdom was invalidated, directly into their hands without question or qualification, which gets to the question of like, it gets to a lot of questions, but I'll stop there. I'll give you a sense of, I think, what I think is going to be necessary for a new reality to be possible. And I see that reality happening in Memphis, in Detroit, in Boston, and in so many communities where leaders like the three of you are just making it happen. You're just making miracles happen. And if we can get you the resources that you need, babies are going to be okay. And everybody else is going to be okay too.
Oh, thank you, Tosh. So much richness there. I want to lift up the healing of harm, right? Um, in addition to consciousness and acknowledgement, um, there's healing to be done. There's action to be taken to repair harm. And there is acknowledgement of the wisdom and the evidence base that is needed. And so I thank you for lifting that up. And the idea that communities in our power, standing in our power, can transform institutions, which I just want that to resonate with folks in who are participating in this webinar, right? That now is the time for us to do the things we know are right. And with that, transitioning to Nashira, and connecting to this idea of radical imagination, of redemption. Can you talk about the importance of transforming the narrative around Black birth in this country? And what type of documentaries do we hope to be seeing 10 years from now, 100 years from now?
Thank you. This is so rich. Such a rich conversation. And I'm here with Noelle, who's my 3.5-year-old baby born right over there in our living room at home. Such is this moment of parenting while working.
Noelle.
He's like the birth center equity godson. He's in all of our meetings. There are so many midwives on the line, so they can attest to this more than I can as someone who's not clinically trained. But when we are fearful, it's hard to give birth, right? The body like tenses up. And I think that is true for individuals. I think that that's true for our collective. So because the dominant narrative right now around birth is of fear and pain, and that the pain is very founded. The fear is founded because of the trauma that we've experienced, collectively and individually as a result of the system that we've created. But it's also upheld by by media, right? Like, when's the last time in a movie you've seen a home birth or an orgasmic birth or anything that offers a promise of something different? So we're just entrenched in this, a lot of fear and narrative. And I think that impacts us individually, and then it impacts us collectively. And so in my work to open a birth center here in Boston, when we were surveying community to say, what do you think? Like, should we do this? And what we heard back was, birth centers are for crunchy white women. And that Black woman wasn't wrong in that moment, right? Because all of the data around us and right, and the history of how birth centers got so white and how midwifery got so white kind of speaks to that, like who held on to that. And that's why this moment of reclamation is so powerful, right? Because when we understand the history, it's not the history of Black midwifery, it's just that the history of midwifery is Black. then we can like lean into that. And I think that there is a healing that is possible for us and for like friends of mine who have been interested in home birth, but have said, you know, I'm interested, but my abuela is like terrified, right? But we can reach into that history and bring our grandmothers and our, you know, elders along with us and collectively heal. I think that there's a really powerful story to be shared there, and that what's possible for us collectively, you know, in the next 10 years is that like everyone knows a birth center, everyone knows a midwife, that in my circle of, you know, in my social circle, I'm not the only one that's given birth at home. And then we are kind of reclaiming that as the norm, and that the systems then follow suit, right? So that the payers, the hospitals, right, the reclamation happens by community. And in doing so, the levers of policy and the ways that birth and birth center care needs to be supported kind of are following the powerful narrative shift. And I think I'll just add one other thing, that like, even in the last 6 years of doing this work locally in Boston, Jean DeClercq, who's one of my advisors, has always said, you know, if how will we know if people are going to come? And we felt like in the last couple of years, even the movement on social media and Instagram of people telling stories and sharing birth photography, and just this really powerful kind of shift. And then of course the crisis, the healthcare crisis that we're in right now with pandemic, has really shifted things, and have people asking, well, what are the possibilities? What else is out there? Tell me about your birth story. I didn't know that was possible. So I think there's a real power in the sharing and in the narrative that we're holding collectively, that's inviting people in to imagine a different way, and to imagine and to like understand our history. And I think that has a lot of power, not just for people who are going to give birth now or in the future, but just like across generations, that we carry that with us. I was at my sibling's home birth when I was 7, and my daughter was at his birth when she was 4, and just that becomes the norm and part of the data that we have in our bodies of the experience of birth, that is how they begin to understand birth and what's possible, and that, you know, crises and radical interventions are the exception. So I think that the videos we'll be sharing in the future will have, you know, powerful home birth stories with siblings cutting cords and 7-year-olds dressing up as midwives again.
Yes, 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 yes. And so, resonating with the chat is moving, and someone in the chat is lifting up not only the piece about possibility, but about our right, right? Our right to midwifery care, which I want to acknowledge. And then the Q&A, we've gotten a number of questions in our Q&A. And so we're going to go there in just 1 second. Before we do, I just want to ask each of you, is there more you want to share about your vision for the future of midwifery and birth centers before we go to our audience questions?
Yeah, I think that, you know, we are the answer we've been waiting for. And that, you know, one of the things that, you know, I realized when I decided to become a nurse midwife was that we had to be a disruptor to this system that is not created for us. You know, it was never created to care for us. It was never created for us to thrive and be healthy in. And that we can collectively change this system. We can collectively create a new paradigm of how healthcare is being delivered. And that is, you know, that's my hope, and that has always been my end game goal, you know, which is to create a new system for us, and also to just grow more providers, grow more birth workers, not just midwives. I mean, we need doulas, we need lactation counselors, we need community health workers, and really to return healthcare um, to the community, and and really educate people that health and healthcare is a right. It is not a privilege, and we really have to move away from this capitalistic model of healthcare. No one should be profiting off healthcare, and so if we don't do it, it won't be done. And I think the time is now, and I think that we are the group to do it. I think that, like Taj said, we are definitely moving it forward in the spaces that we are in, and we're coming together collectively to do it. And that there is enough resources. There are enough resources out there for us to do this, but we have to make the demand, and we have to continue to educate folks on what their options are. And I think you'll get to the questions. I know someone asked about high risk birth, and I really do want to address that. And, because Memphis is a community that really is sick, and we recognize that, but we also recognize that everybody deserves a midwife, and everybody deserves this type of care. And,
Yes.
and we have the capacity to care for all of these people in our communities.
Mm-hmm. I want to actually, Nikia, take a pause there, and let you go ahead and address that, because I, also see some comments in the chat, and want to, have you just to speak to us about the evidence base and the safety, for this type of care, and the integration of this type of care in our health system. So if you want to go ahead and speak to
Yeah.
that.
A lot of the people that we care for and that we were seeing that were coming to care were what would be considered high risk. And so we had to make a decision. How do we provide them with the best care that they can get? Our system is broken, is fragmented, the care is fragmented. And I think that COVID also has just exposed that even more. And what we realized is that we could actually bring together that team that they needed to be cared for. And so we partnered with maternal fetal medicine. We partnered with a few OBGYNs that could help us to care for them when what their issue was out of our scope. But we brought that team together, and we did it as a team approach, and that has been very instrumental in creating better outcomes for them.
Yeah.
So that is really the way we have approached our care here, and our care choices, and the way that we're training the next group of midwives, because it isn't, oh, you risk out of our care, we can't see you anymore. We still have things that we can do with them, education we can bring to them, and really can do that care coordination that they're not getting when they go to the hospital or go to these clinics where they have to sit 2 and 3 hours. And so that care coordination, that realization that we are a part of a care team and can bring that whole care team together to really increase their chances of having a better outcome is really important, which is why it's really important for midwives to be solidly integrated into the medical community where they are. For so
Absolutely.
long we've been pushed out to the margins, and honestly, those are the people that I'm caring for. I'm caring for those communities that are on the margins, and I'm going to pull them in and get them the care that they need.
Mm-hmm. Thank you for that.
Yeah.
And I see Nashira is ready to jump in. Go for it.
I'm just like, thank you, Nakia. And I think what I want to layer on this is, while you are providing that level of care, and the interpersonal care and the clinical integration, it shouldn't be at the added expense of trying to rub two pennies together to save lives. Like, I think part of what we're saying here is that the system is broken, and the inherent power imbalance now of Black midwives and communities of color trying to reclaim midwifery. I'm seeing a lot in the chat around, midwifery school and precepting and opening birth centers, which we know is inequitable in just how birth centers are open, that most midwives are opening birth centers using their own personal savings or lines of credit. So there's an inherent, inequity baked into that. And then we're trying to negotiate with hospitals, trying to kind of rap on the door and be like, can you help me with a transfer agreement while we try to save lives in our community? So I think, I'm just kind of resonating with all that. And it's not without a cost, an added cost to Black women and providers and midwives being the ones to respond to the crisis that we didn't create. it's exhausting, right? So there's this like call in to philanthropy, to to all the resources, to say like, if we can follow the lead of communities of color, right, in this reclamation of this model of care that is better for everybody, right, then everybody wins, right? I just think there's a real way of like, but making sure that it's like just interrupting the expense right now that I'm seeing of all of, midwives of color and Black folks trying to work on opening birth centers, that is at an added expense, right? An added kind of emotional cortisol, right? Where in many ways, like the trying to climb out of this is a recapitulation of the same thing that got us here.
Yes.
Just to build on.
And
Oh, go ahead, listen.
I was just going to emphasize in this moment that um, the evidence base supports this, and increasingly, experts across disciplines in a recent report, National Report on Birth Settings, recommend the integration of midwives and birth centers and collaboration across birth settings to benefit our whole health system. And so that is important to acknowledge. Taj, go for it.
Yeah, just building on that, I think what the evidence base is clear, the history is clear. And what's also clear is that there are more than enough resources in the system to change outcomes for especially those who are not getting the outcomes that we need, right? So we have the answer, resources are there, and really the only question is, are we going to get the resources that are there into the hands of the people who are actually doing the work and producing the outcome? That's really the only question on the table, right? That's the only question, right?
Mm.
Because as you were saying, Nashira, right now, we have a little joke within, my little joke within DCE is it only works for free by 2023, because I keep hearing stories of like the care providers in our communities are going to provide the care, whether the person has resources for that care or not, and whether they're going to get reimbursed or not. And what that means is we've got a lot of our folks working for free. You may get paid for a little bit of the time you put in, but the folks who come to this as a calling, as a mission, as a calling, are just going to do whatever they have to do to make sure that our folks get what they need. Because as Nashira said, we're solving a problem that we didn't create. And now the people who are willing to make that sacrifice need to be resourced to provide that care in a sustainable way. Because
Yes.
we've lost some of our elders in recent weeks, and it's heartbreaking. And part of the loss is connected to the sacrifice that they've made over generations in time, and we owe it to them for that to change now, right? Because
Yes.
the resources are there. We just need to get them in the hands of the people who've been doing the work, and they're going to keep doing the work, and need to do it as a part of the kind of care teams that you've described, that you're able to pull together that give everyone a role in the process.
Yes. Thank you, Taj. And so moving to our Q&A and linking up to that, I'm gonna um, look to Nashira. We have a question about how you create your own birth center. So can you talk about a little about that and about birth center equity as well?
How you create your own birth center. Build community, right? Because it's part of anchoring in this history and knowing that, demanding that this is the kind of care that we deserve. And for us, it's really been a community-driven process, right? Of just saying like, do we want this? And where do we want it? When do we want it? And as such, as Tosh said, it's been an unpaid and kind of long process, but there's a real movement afoot. And that's where I think the energy from Birth Center Equity, is kind of invigorating all of us, where, when I met Leslie, I was like, there's another person out there working on a nonprofit birth center, like who's also PS, not a midwife. But now this network that we've created of birth centers led by Black, Indigenous, and people of color is really providing us the community to lean in and say, how have you built your board, right? can you share your operating budget with me? You know, how are you negotiating with payers? So we're really kind of building those supports among one another. And there's a whole, you know, bunch of resources from the American Association of Birth Centers as well. So I think, you know, we're augmenting those resources and tools with what we need. And I think that my hope is that we can release the resources, as Taj has been talking about, right? That that we don't have to be working, you know, for free, or that midwives and folks aren't going into personal debt to open birth centers to respond to the need. And so Birth Center Equity is, you know, has built a network of BIPOC-led birth centers. We invite folks who are birth center dreamers and visionaries to join us in the Birth Center Equity community, where we're sharing tools, supporting each other, talking about narrative, and just, you know, just listening, right? And learning from the elders, those chronologically elder, but also the elder midwives like Nakia, who are the birth center OGs, where we have a lot to learn. And I think that replicating what's working and leaving behind what's not, and doing that particularly with a lens on, you know, racial equity. Because I think that I was talking to, one minute, please. 1 minute. I was talking to a young white woman recently who was saying, like, you know, I just didn't even know that midwives were an option. And then when I tried to find one, you know, I couldn't really find one. It was like a default to an OB. And I think if we can get clear that it's racism, white supremacy, and heteropatriarchy that made it hard for a white woman to get a midwife, because we decimated the practice, right? So that by like following the lead of folks of color in this reclamation, everybody can get access to a midwife.
Okay.
All right,
So
I'll be back.
Noelle needs you. From our chat Q&A, somebody is asking where the money resides to do this work, and a lot of us know that reference. But I'm going to ask Taj to speak about where these abundant resources might come from.
There's a lot of important work that many of the folks on this call are doing, because there's significant resources, public resources, that come into the healthcare system through the federal government, through states, through counties, and if folks are doing work at a state level and federally, they just change laws and policies so that the care that's being provided is a part of the continuum of care, and it's compensated reasonably and fairly for the work that folks are doing. So, you know, if we just looked at that and we just made the kind of adjustments we need to make there, that would go really, really far. To get there, philanthropy needs to stop sending you all, or not even, you know, you need to be on the radar of philanthropy, and philanthropy needs to be inviting you to ask for significant resources to acquire land and buildings, right? So capital resources at scale. And Nakia can talk about sort of the success around this in terms of what you've been able to do in terms of partnering with philanthropy and government to bring resources into a model that can provide service at scale and be replicable. So I think you're really demonstrating on the sort of economic side that it is possible to bring those resources in, and how you bring those in. But what you've been able to do in Nakia in Memphis is pretty unique, in that what I hear from most folks in most cities is like, you know, they've asked us to put in another, you know, proposal for a $5,000 grant. And if you're trying to do all the things you're trying to do, you can't be spending your time chasing after $5,000 here and $5,000 there. That's just not going to work. So, so there's significant resources in philanthropy that are not being deployed sufficiently towards your needs. And then also there's, for those of you who are not working just in the nonprofit birth center context, but have a, you know, revenue model where you're generating profits in what you're doing, there's also work and opportunities for impact investors like us to come in and help support with those kinds of resources as well. So so there are a lot of resource pots we can pull from, and everybody across the board is underperforming pretty horribly in terms of showing up with what's needed. So we don't need everybody to, you know, improve right away, but yeah, there's lots of room. There's as there are for most things, it's lots of money for everything we need. It's just not flowing to the people who need it. So.
Yes.
Yeah,
They,
I agree, Taj. I think one of the biggest things that was helpful for us was really telling the story. Um, we really had to tell the story over and over and over and over again. In order to get people to buy into it and to really see the vision. But you're right, there's a lot of money out there. It's just um, I don't know that it's going to the right places. I think that a lot of times what we're seeing is a lot of organizations that are getting funded are the ones that normally get funded, and they're not necessarily making changes. They don't have the community backing. They're not really speaking for the community. And so we really have to change the payer model, really, and how these philanthropists and these foundations really fund organizations, because those who are on the ground that are doing the work are not usually the ones that are getting the money. And like Nashira said, what we're seeing is a lot of midwives who are really making huge sacrifices in order to practice, and it shouldn't be that way, because what we end up doing is being burned out, and then really that midwife is upholding a whole community, right? And so when she's gone, it's a huge loss. And which is why, especially like here at Choice, is one of my greatest fears in the beginning was that the practice would be built upon me, and then if something happened to me, the practice would go away. And so, which is why, to me, growing the workforce and training and replication is so important. And we have to really be able to sell that to funders and help them to understand that we have to be able to replicate ourselves and replicate this model in order to make true change. We can't continue to just fund individuals or individual dreams. We have to look at this thing big picture.
big picture. And so, in doing that, looking at the big picture, thinking about the funding, there are also questions in the chat about policy and about credential as well, right? So I think one participant is asking about CPMs in your birth center. Nakia, you want to speak to that?
Yeah, to us, it was really important that we also have CPMs that work with us, right? I mean, they're midwives. They are midwives that are experts in out of hospital birth. And unfortunately, nurse midwifery in our education is focused on medicalization of birth and hospital birth. And so integrating people into those, integrating midwives into that system to really uphold that system, right? So how can we partner with CPMs and direct entry midwives and those who are seen as experts in out of hospital births and who are trained in that way? And so that was really important to us as well. And we have CPM students or CNM students. We don't care. We're growing midwives.
Yes, that's one of our commitments at Birth Detroit as well. CPM, CNM, and cross credential solidarity in our clinic and in our birth center. Nashira, I see you have your hand raised.
Well, now I have a couple of hands raised. I just want to say quickly that, in Massachusetts, our CPMs aren't licensed, right? So there's back to the policy thing that we've got to be, organizing to move legislation to license CPMs. And then also all of the policy work to, address regulations for birth centers that frankly are kind of rooted in a hospital obstetrical model that create a lot of barriers, both in terms of the economic burden on birth centers, but are also don't really honor the full scope of midwifery. And so again, back to like who's doing the work, it's like we're looking to folks who are unpaid or underpaid to be fixing all the problems, right, while catching the babies. And Nakia, as you were saying that at the start of the birth center choice, is just like having to tell the story. I think when we think about narrative too and what's possible in the future, that the story we're sharing is of possibility. Because right now the experience is so often, can you come to my panel and tell the story of the maternal health crisis, right? And just kind of like continue to bleed and show your trauma and just tell me again. So how are Black women dying in childbirth? Like, it's just so, the evidence is there, right? And frankly, it's not like the maternal health crisis, in this country, like maternal care is just not working well for anyone. And at the expense of folks of color. And I just think the stories that we should be telling are the stories of what's possible, right? Because we're asked by the same system to just sit in the wound, right? To just sit in the wound all the time and go back and tell me again, and sit on that panel and tell me again.
It's a distraction from change.
It's a
It is.
distraction.
And I don't tell that story.
It's
That's not the
re-traumatizing.
story I'm
No, I know.
interested in.
That's why I wanted to lift up. It's re-traumatizing. And I think it keeps folks steeped in, well, that seems really scary. That kind of childbirth probably shouldn't happen outside of the hospital if so many people are likely to die, right? And so it's just like, it's not a liberating frame. And I think the stories of what's possible, like we saw of Rhonda's birth at your hand, Nakia, is just like, really, really powerful. We have to honor the loss, and we've got to tell the story of promise.
Mm-hmm. I want to bring another question back to Nakia, and this moves us back to centering the birthing person, focus on the individual, and on healing trauma. This participant is asking about how birth centers hold and support mothers who've experienced sexual trauma and birth trauma. Nakia, can you speak to
I
that
didn't
for
hear
us?
you, Leslie. I'm sorry.
Oh, I'm sorry. We have a participant who's asking if you could speak about how birth centers hold and support birthing people who have experienced sexual trauma and birth trauma.
Yeah. With us, it's really important to us that we know and help people through that process. One of the things that was hardest for me when I became a midwife was everyone coming into and sharing their birth trauma. I felt traumatized. And really we started to think about it in a different way of trying to help them rewrite their birth story and to create a new one. And so we would talk about what happened in the past, but also what we wanted to see in the future and how we could reach that goal together. Um, Sexual trauma is really, really important to talk about because a lot of those things definitely come up throughout the course of a pregnancy. And so helping people to process that, but also really trying to help them find resources. We have some people who are suffering and that they need someone to talk to outside of us, even though, we are counselors and now social workers. We really work really hard to kind of pair people with counselors in the community that can help them. But of course, one of the biggest shortages that we have seen, or definitely that I have seen since I started practicing, is mental health services. And so really trying to reimagine how that will look, and really even talking about adding those services to our own space in the future, because it's so real and it's so important. But yeah, we definitely talk to people about their care, the care that they received in the past, and really try to help them find ways to navigate that, and so that they can know how to advocate for themselves in the future as well. So that's really important. We want people to leave our care feeling empowered and feeling stronger than when they came in, and recognizing that not only do they have that power, but their partners and their family members who can advocate for them as well. I think that's really important because a lot of times, especially in birth and pregnancy, and even when any sickness or illness, that is not a time to really be arguing with people to advocate for yourself. So we really have to help train family members and loved ones to be able to do that as well.
Mm-hmm. Thank you. Thank you. Nashira, your hand is up still. I'm not sure if that's okay. All right. So then moving to more questions here in our chat box. We have a question about birth centers created through worker owner cooperative models. Um, any knowledge of birth centers created through worker owner cooperative models or other creative models you all want to share?
I'm looking at Taj. I don't know of any birth centers or worker-owned cooperative, but we are learning a lot from a worker-owned, worker self-directed nonprofit here. And I think that there's a lot that I want to integrate into that. And I think part of what, back to the how to start a birth center question from earlier, is what we don't want to do is replicate an organization, be it a for-profit or a nonprofit, that you know, it can be led by folks of color and still maintain all the tenets of white supremacy and capitalistic culture, right? And so we're trying to think about how to do it all differently. And in doing so, there's inherently some risk, because we're like, you know, well, how many years until we break even? And how are we gonna, we're talking about having, you know, mental health providers and craniosacral providers and Reiki. And I'm seeing chats about, you know, herbal medicine and like, but then when you go to the business plan, we're like, well, that, you know, you can't actually afford to, you know, reimburse for those things. So it's all feels like it's trying to reimagine and recreate while kind of feeling often bound to what's currently reimbursed, what we can currently get grants for. But I love that idea. And I think that there's a lot of potential for kind of liberated worker-led models. And I see Taj resonating too.
Yeah. So a big part of the work within BCE is just getting resources. Let's just get resources into the hands of folks doing the work. That's sort of step one. And then there's another part of BC, which is called the Catalyst, which is where we're working with right now a small kind of subset of the community to really think through what the different kind of business models are within some of the different birth centers. And folks are sort of doing it in different ways. And so we're trying through that work to kind of learn about, you know, sort of Nakia, in the model that you've built, like the economics of that, when you've got full spectrum and comprehensive reproductive health services combined with birthing services, and kind of how that changes the economics of an entity. And then other folks, you know, doing it on, you know, fully on the nonprofit side or doing it on the mix. So there's a process right now where there's a lot of learning and exchange happening between sort of economic models at the level of the birth center. And within that, there's definitely, we have a lot of partners in other work we do who are doing that kind of community work through co-op models. And I think we're going to start to see some more kind of innovation and experimentation with that. That's definitely a way to go. But partly what we're trying to figure out there is that work is really informing what the policy agenda is, because as folks in different states are trying to figure out like, well, how to get licensing. And it's like, oh, well, in our state, you have to have 5 different sinks because you got to have a sink for this and a sink for that and a sink for that. And, you know, in New York, they make the regulations so hard that it's just like impossible to do anything, right? So you're trying to do the economics of it. And then you're dealing with the regulatory environment that's really, really uneven and unfair and discriminatory on a state by state basis. And then collectively trying to get the rules such that we're kind of eliminating those barriers. And then there's the other piece of this, which is like, you know, if you think about hospice as a form of care that's provided in a hospital setting, in a community setting, and an in-home setting, the hospice economy, if you think about it as an economy, is at a certain place in its development. Like some of the regulatory stuff's been figured out. There's still a lot of problems there, but a lot's been figured out. And the financing mechanisms are such that like hospice works. Right now, community birth infrastructure is 5 to 10 years behind hospice. But what we're also doing is thinking about like, how do we build an economic model and strategy such that the sort of innovations and solutions that are being developed in Memphis and in Atlanta and in Boston and in Detroit, that we have sort of an economic model that allows those different approaches to thrive, right? We don't want to standardize it. We want to build on the diversity of it. We kind of have to build a whole economic strategy. So that's another big thing that BCA is sort of working on right now, is kind of literally from the ground up, like how do we sort of have the lessons inform the policy change, and then have the policy change inform a broader economic strategy for community birth infrastructure that's sort of comprehensive in the way that you outlined earlier in the field. So that's some of the work that BCA is doing.
Mm-hmm.
A piece of that, but it's a question within a bigger set of economic puzzle that we have to collectively kind of work out together.
Yes. Thank you, Taj. And speaking of policy, we have a question about federal policy and our current administration in Washington. Does anybody want to speak to how federal policy supports or doesn't support this model of care?
What did you ask? How federal policy support?
Supports or doesn't support this model of care?
Mm. Well, that's an interesting one. Of course, oh, Leslie, you didn't have to ask that question.
Sorry.
I'm
I
gonna,
didn't ask it. I'm gonna name the person. Let's see who put that in the, go ahead. Sorry.
well, we're not gonna talk about, I guess there are a few different acts out right now, right? We got the Mom the Bus, which is, a collection of policies or bills around, to improve the health outcomes around Black maternal health. Those include like the Kira Johnson Act, and there's something around the perinatal workforce. Talk about maternity care and support for pregnant persons who are working. Um, there's something in the Mom the Bus around, I think, incarcerated women. Um, so, the Mom the Bus is pretty big, right? And then of course there's the Moms Act, which is just around, I think, in increasing like postpartum coverage for persons who are on Medicaid, extending it past the 60 days. Of course, right now it's 60 days for those who are on Medicaid, then they're kicked off Medicaid, right? So I think that the Moms Act is trying to extend that to a year postpartum, and also to, I think, if I remember reading it correctly, talk about adding coverage for doula services and things like that, right? So the Moms Act is just much smaller, whereas the Mom on the Bus is focused more on Black maternal health. Then there's the Babies Act, and the Babies Act is focused on birth centers and basically reimbursement for birth centers and monies for birth centers. And it has some inherent issues, but we don't have to talk about those so right now. But there's a lot of legislation out there right now that is being pushed to try to expand access to birth centers, as well as expand access to midwives, hopefully doula services, lactation services, and also expand postpartum past that
Yes.
60 days.
Thank you, Nakia, for answering that, even though it was a difficult question. We're at 4:50, and so I want to give each of you an opportunity for any final words before we move to close today.
Just building off the last part of the conversation, Leslie, I'm just curious if you might use a little time here for you to say what might be important for folks who got the Black Lives Matter poster in your window. You've made a commitment to show up for the communities that are not being served and are being harmed. But you may be advocating for things that are actually harming our community. I'm asking you because this is happening right now, right?
Yeah.
Our allies and partners are not being the best of allies. And I just think this is an interesting moment to say, like, if you're asking yourself right now, is that me?
It might be.
You're like, me, I thought I was showing up for folks. I was committed to showing up. I thought I was showing up, but maybe I'm not showing up.
Yeah.
You'd like to share, Leslie, for the folks
I would say
showing up in the way they need to.
yeah, thank you, Taj. I would say that we need to take the time to explore the nuances. One of the ways in which this happens, that folks move forward with things that don't actually help our communities in the way we hope, is in the name of simplicity, urgency, expediency, and something is better than nothing, and it's not, right? And so I think we need to take the time to connect across our differences, and to really understand what our communities need. And for those who want to be not allies but co conspirators with us, you have to be willing to take that time and to listen and to also take the risk that is inherent in doing that. And so but I don't want to take up too much space. So, Nashira, Nakia, any final words?
I'm just, I'm so feeling the love in the chat, and it's exciting to see a whole bunch of like new names and people we don't know and aren't connected with. And I'm feeling right now as I sit in Mattapan in Boston, just this whole network kind of lit up, and feeling a lot of potential. Like I think that we are in this moment made possible by, right, our ancestors and by all of the birth workers and healers and organizers that have come before us, and accelerated by the trauma of the last year, where everyone was like, oh shoot, I'm not trying to go into a hospital last March, and but do you have a birth center? Where's the home birth midwife? Oh right, we eliminated those, right? So I think that there's been this moment, and you know, kind of, and I think an opportunity to really lean in to follow leadership of folks of color to liberation, right? Because if we can design the intervention with an explicit understanding of all of the levers of inequity and structural advantage, right, then we can create birth centers and birth infrastructure that works for Black, disabled, trans, queer, you know, non-English speaking folks. Like when we can do that, then we will have created a birth center that works better for everyone, right? And so I think that just an intersectional approach to understanding how we got here is the answer to how we get free. And like that's the world I want to live in, and that's the birth center I want my kids and our seventh generation grandkids to have access to.
Final panelist words to Dr. Nakia Grayson.
Amen.
Amen.
That's the world I want to live in too, Nashir, and that's the world that I'm creating. You know, that's one of the things that's so important to me is that, you know, we treat people like we want to be treated, and that the golden rule. I mean, and that we create, you know, spaces that are safe, not just for our patients, but also for our students and for our workers who show up every day and, you know, and make those sacrifices to be here and to show up for families. So I think those things are important. And I think that we can do it. You know, I'm hopeful every day, you know, when I walk into this building, this 16,000 square foot building that we built from the ground up, you know, the first birth center here in Memphis, and the fact that we were able to imagine it and then, you know, realize it's been a true honor, and it's an honor to care for these people in this community that show up every day and trust us. So, you know, it's possible, it's doable. We can dream it, we can do it, and I think that we can all do it together.
Thank you. And so, as we come to a close, I want to say thank you to our illustrious panel, our fabulous filmmakers and organizers, our sponsors. I want to invite you all to learn more about Birth Center Equity at birthcenterequity.org, to support your local Black, Indigenous, and people of color led birth centers if you have one, to donate and invest in growing more, right? So join us in Birth Center Equity and really working to create a world where birth centers are a part of integrated health systems and where we have a vibrant community birth infrastructure that is created for our communities. And I want to invite those folks who are ready, right, beyond reimagining, right, to acting and leading with us in this work. We welcome you because, and I use the words of Just Transitions, if it's the right thing to do, we have every right to do it. And we have evidence base for this work, and it is the right thing to do for the future of our families. We have a closing survey for you. It'll pop up automatically at the end of this event. Please take it so we know what we can do to improve upon having conversations like this one. We invite you to check out the full documentary and other videos from Retro Report via their YouTube channel. And you will receive an email follow up with all the links and resources. And thanking you again for your time. Thank you so much and have a good evening.
Thank you.